Hi, my name is Julia. I'm going to be your student nurse today. Can you please tell me your name and date of birth?
Haley Jane, August 29th, 2000.
Okay, and then today we're going to be assessing your abdomen, your neurological system, and your musculoskeletal system. So first we're going to do your abdomen, and if you could just lay back for me and lift your shirt. I'm going to start by inspecting, and I see that your abdomen is symmetrical, that there's no lesions, the color is even, and I see no pulsations. So after I'm done inspecting, I'm going to go ahead and auscultate, starting in the right lower region. What?
Wait, no, that doesn't sound good.
Okay, with my diaphragm. And then I'm just going to go up to the right upper, left lower. And then I can check again with my bell side for bruise. And I'm going to check the aortic pulse. Okay, and I do not hear any abnormalities. So your abdomen sounds normal. And now is the part where I would percuss, and then I'll palpate. So I can palpate the liver, which is up under the ribs and a little bit under the ribs, and then the appendix, and then the spleen. And that is all for your abdomen assessment. So we're going to go ahead and move on to the next part, which is your musculoskeletal part of the assessment. So I'm going to check your neck, and I see that your neck's intact, and I'm going to check your range of motion for your neck. So if you could move head down, and then head back, and then side to side, and then just go all around. And your neck is normal, your range of motion is within limits, and your posture looks normal. I'm going to assess your spine. Your spine looks normal, there's no abnormalities, and there's no abnormalities of the neck. So I'm going to now palpate your joint of your elbows. So your elbow does not is not swollen, and there's no abnormalities, there's no crepitus. And your other elbow is also normal. So I'm going to check your range of motion now in your feet. If you could point your feet upwards towards your knee, and then point your feet downwards, or toes, and then if you could move them in a circle. And you have complete range of motion in your feet as well. So next we are going to be moving on to the neurological part of your assessment. So I'm going to first assess the strength of your hands. If you could push this side, push back the hand, and then inside and the back. And you have normal strength, there's no abnormalities there. And I'm going to next do if you lay back please. I'm going to push my hand against your foot, and opposite side, and again. Okay, and then next, if you could stand up please. I'm going to ask you if you could walk to me. Okay, your gait is normal. There's no abnormalities. Your hands are swaying normally. And then if you could next do the tandem test, which is if you could put your feet, one on top, okay, and then walk towards me, okay, and then walk back. Looks normal. Okay, and then the last thing that we're going to do is the Romberg test. So if you could stand and close your eyes for 20 seconds, and I'm just going to make sure you're not falling, and I'm going to watch. There's no abnormality of swaying going on, just a slight sway, which is normal. Okay, you can stop now. And that is it for the assessment. You're done.